area of concern for some of us who are mindful of the rate of incidence of AIDS among black men, particularly. And for, I don't know, half dozen years or more, I was the chairman of the National Black Leadership Commission on AIDS, which was founded by Deborah Fraser House. The current chairman is the Reverend Dr. Calvin Butts. And in an effort to encourage people to be tested, because there are folks walking around who are HIV positive today and do not know it,
Exactly.
and they're spreading it.
Exactly.
And so one day, and I've told this story on the air before, Dr. Butts came in the Abyssinian Baptist Church on a Sunday, running a little late, and he's always very prompt. And he's buttoning up his tunic, and he got up in the pulpit, and he said, "I want to apologize for being late, but I was outside getting the results of my AIDS test." Because when this occurred, it took a couple of weeks or more to get the results. Today you get it in about 20 minutes.
Right.
But so this was his way of saying to this congregation that probably figures he walks on water anyway, that if he can go get tested, I should go get tested. And it is sad and unfortunate that so many people, it's not limited to folks of color by any means, but we just don't want to know. Don't want to know.
We have the higher rates. Yep.
Yeah, that's very true. And in fact, at our national conference, one of the workshops was dealing specifically with risky behavior and focused quite a bit on HIV and AIDS. And it's not only black men, but black women.
Of course.
And there's this fear of getting tested. The other fear is using condoms, safe sex. Just a lot of us don't want to do it, refuse to do it, and we're exposing ourselves to a potential deadly disease.
Well, I'm happy that 100 Black Men is involved as it is. Way back when we determined to come together as a group, we had no idea. At least I had no idea then how much good we could do. I knew that there was a need, which is why we came together as we did. And but when I think of like the Eagle Academy especially, I'm so proud of you all. I don't know what I can do, but I mean that is outstanding, and the mentoring aspect of it, and now we're going to have some more Eagle Academies,
Right.
and but in combination with learning, there is health.
Exactly.
Because as is pointed out repeatedly by some folks, if youngsters are not sufficiently well, they cannot learn. And I'm on the board of something called the Children's Health Fund, and also the Association of Benefit Children. I do a lot of things involving kids because I like kids. But the point is made that if the youngster's sitting there in the front row and the teacher thinks he's stupid, he's not stupid, damn it. He can't see or she can't hear. And so the health and wellness go along with education. And because our folks have been discriminated against for so long, and even today we have situations wherein our youngsters are not getting the education they should get because of the situations in our schools, not just in New York, everywhere.
Right.
I went to school in Harlem a long time ago, and in Trenton, New Jersey, and but I consider myself very fortunate because of teachers that I was lucky enough to have were concerned and thought that I could learn.
Right.
Because so often the problem is an absence of expectation. They figure out Now, I remember a time when if you wanted to go to college, you had to have a foreign language. So in high school, the guidance people would direct a lot of black kids away from taking a foreign language. They say, you're not going to college anyhow, so you don't need to take French or German or whatever. And but the fact of the matter is, now that we have demonstrated that we can produce a president of the United States, people begin to look a little differently. They say, gee, those people can read and write and count and think like everybody else.
Exactly. And in the mentoring program, we definitely try to hone in on building a culture of health. So if the kids can learn at a very young age the right foods to eat, the right things to stay away from, to stay away from risky behavior, have high self-esteem about themselves, then when they're adults, it's not like they have to think about it. It's just natural. And that's
Do
what
you
we're
have
trying
any
to get to.
children?
I do not, no.
Do you have any children?
I do not either.
Well, you guys haven't lived, man.
Oh, I have 3 mentees that I
Well,
watch over. So.
My bride and I, we'll be celebrating our 60th wedding anniversary in August, and we have what I call a little boy and a little girl. The little boy is 58. I call him Daddy's little fella, and he does not object. He does not object. And I look at him sometimes, and I say to my wife, I said, look at him. And he was 8 pounds, 5.5 ounces. And she says, I remember. But I love children. They're the best. They are. It's sad and unfortunate that some folks don't. Well, I say they don't appreciate how blessed they are if they happen to have kids. You really should take care of them. And I tell children all the time that remember now, the big ones take care of the little ones. And then I always tell them, whatever you do, don't be a bully. It's uncool to be a bully.
Exactly.
These are little rascals, 8, 9, 10 years old. And they're the most fun to talk to. Now, where I teach at Columbia, I have graduate students, each one of whom is a whole lot smarter than I am, but I enjoy them so much. And that's our future. Because
Absolutely.
we adults, we don't own the planet. We hold it in trust for them. And you all can say you gave at the office, because what you do is really good work. 100 black men is lucky to have you.
Oh, thank you.
Thank you.
Thank you. You know, another point in regards to disparities, and actually this was brought out by the American Cancer Society as well, and that is that disparities of higher death rates, latter stage diagnosis, and poorer survival rates for most cancer sites compared to whites is mostly because of the difference of socioeconomic status rather than biological or genetic factors. You know, African Americans are significantly more likely to be poor and uninsured compared to whites. Poor people have less access to quality health care, including screenings, and are more likely to be diagnosed with advanced cancer. One of the things that hopefully is going to address this is the Affordable Care Act, which should address some of these disparities by increasing the availability and affordability of quality health care.
Obamacare?
Including,
Exactly.
exactly. And in fact, Errol, why don't you kind of
Sure. So
expand on that?
it's a good point, because there was a workshop at the national conference specifically on the Affordable Care Act, or Obamacare. And one of the biggest issues about men of color, women of color getting access to care is that they don't have insurance. And so if you earn above $16,000 a year, you can't get Medicaid, public insurance. And if you're younger than 65, you can't get Medicare, public insurance. So you're stuck in the middle without insurance. And so you don't find out you have something until you end up in an emergency room and the hospital finds out, usually too late. So what the Affordable Care Act attempts to do, and it starts in 3 months, it's coming in October 1st, 3 to 4 months from now, is lower the cost of insurance through tax subsidies. So people who earn above $16,000 and make below $45,000 is going to get money from the federal government to lower the insurance cost. And this is supposed to make, right now there's 50 million people without insurance, and it's a disproportionate share that are African American. And they'll be able to get coverage $50 a month, $100 a month, $120 a month with these subsidies that come, rather than today $500 a month, $1,000 a month. It's way too expensive. So one of the big issues is education and awareness, so that people know that this is coming, know how to sign up, know where to get the information, especially folks of color, because this is their one time to get insurance coverage.
Well, unions have done a pretty good job of taking care of their membership like that, and that of course extends beyond the immediate member of the family that is a unionist.
Right.
It would include other people as well. I know I have insurance from Columbia University. And of course, I pay part of the premium.
Mm-hmm.
The university pays some, but I pay some. And then, of course, at my age, I'm perfectly eligible for Medicare.
Right.
And have been for a long time. but amazingly, there are a lot of physicians who don't want to take you if you have insurance. I mean, they want cash on the barrelhead up front. And pardon me, I don't know what that's going to do. Obamacare is going to do for handling that aspect of it.
Yep. So there's actually increased reimbursement rates for physicians who take these, particularly these members.
They'll get more than they have heretofore.
Correct. So
Well, that's a good thing.
and it's for the preventive visits. So if people go for the preventive care visits, the screenings, there's certain, they call them CPT codes. There's certain CPT codes doctors will receive higher reimbursement rates from insurance companies.
Well, I want to
particularly for
pursue that
services.
with you in a second. But you will shortly hear the strains of a number called Little Tiger. And Little Tiger is written and performed by Jay Hogarth, who's the father of our grandchildren. He tells me that I should point out that he's also married to our daughter. And Little Tiger is named for his son, Jamal, who was an infant when this was written. And Jamal is today a proud graduate of University of Massachusetts at Amherst and doing graduate work at the University of Texas. And it is named for him, for Jamal. If you wonder, well, where the hell am I going with all this? The point is that Little Tiger is our signal to take a commercial break. You're listening to Dialogue with Dinkins. I'm Dave Dinkins here with two really civic-minded men who care about us and all of us. They are Errol Pierre and Louis Baldwin, members of 100 Black Men. We'll be right back after this break.